Hi my beauties, welcome back to Younger. Today I'm going to be talking about the difference between Fraxel and Clear and Brilliant. So before I move on, I ask that you like, comment, and subscribe and share this video with anyone who may find this interesting. So the reason why I wanted to talk about Clear and Brilliant versus Fraxel is because this is something that I post on all the time. If you guys follow me on Instagram, you see in my stories I keep you in my pocket, in my lab coat with me, and I take videos all day long of things that I'm doing to my patients and procedures and treatments that we offer. So the difference between Fraxel and Clear and Brilliant, Fraxel is just kind of an umbrella term and a generic term for a fractionated laser. So what is a fractionated laser? Fractionated lasers are lasers that don't treat the 100% density of the skin, but rather just treat a fraction of the skin. So if you're looking at a spot size, which is basically the treatment area by the Fraxel laser or by the laser, it just is going to create zones of treatment within the skin. And if you add in all of the treatment zones, it usually makes up for 50% or less than the affected skin. Now this is in opposed to the old school method of lasers where they would be fully ablative, which they would take off the whole first layer of the skin. We're not treating 100% of the surface of the skin, just a fraction of it through these little zones of thermal treatment. So what happens is the way technology has advanced so far in dermatology and aesthetics is that we've learned that just treating a fraction of the skin has less discomfort during treatment, less recovery time, and has equivocal results to the fully ablative method in physics of the old school lasers. So that's why whenever you hear Fraxel, that's just saying a fractionated device. That's like saying car. You can have a Lambo, a Porsche, or a Prius, any type of car. But there's different types of Fraxel. There's Fraxel Repair, there's Fraxel Restore, there's fractionated halo, there's different lasers. And so the new technology of lasers is to treat in a fractionated manner. Now when I talk about Fraxel Dual versus Clear and Brilliant, because those are two of my favorite lasers, Fraxel Dual is called Fraxel Dual because there's two wavelengths. There's dual wavelengths. One is a 1550 nanometer, one is a 1927 nanometer. Now the 1550 nanometer laser wavelength will target the texture of the skin. So that helps with fine lines, wrinkles, pore size, and the texture of the skin. Versus the 1927 wavelength helps with brown spots, pigmentation, sun damage. So we usually do a ratio when we're doing a treatment on someone, like somebody may have more texture irregularity. Say it's someone, you know, in their 20s with not much sun damage, but they have terrible acne scars. We would shift more to the 1550 versus someone who has more melasma or brown spots or dyspigmentation. We would switch it more to the 1927. We still use both wavelengths to get the most optimal results, but you're going to shift the ratio in favor of whatever skin ailment the patient has. So Fraxel Dual is that type of laser. So when we talk about Clear and Brilliant, Clear and Brilliant is a more watered down version of Fraxel. It's still a Fraxel laser, and there's either Clear and Brilliant or Clear and Brilliant Permea. It's a very superficial laser with minimal downtime. There's almost no downtime. Usually you're red for about an hour after the treatment, and you can go out that night, you can film, you can be photographed that night, no one's even gonna know. So the Clear and Brilliant laser is a great thing to do for people who have a busy social schedule, they're in the public eye or at work, they can't, you know, have any downtime. It's a great 10-minute procedure that we do in the office that will help keep the skin fresh, keep it young, keep collagen stimulated, collagen banks, so as the years go on and you lose collagen, you have some reserves, straight pore size, even out pigmentation. It's just not as aggressive or hardcore as a Fraxel. So I always say about 3 or 4 Clear and Brilliants equal 1 Fraxel. But Fraxel is good for people who are like, okay, I have this 1 week off, I want to get it done, I don't want to mess around with anything, I just want to get my results and have a more aggressive treatment and have it be over with. But in return, the caveat is that there's a week of swelling and redness and downtime. So it's not so terrible that they're going to have to stay at home and hide in their house, but if you go out, it's more like social downtime. You wouldn't want to go to a big event or your friend's birthday party or a wedding when you're kind of beaten up and sunburned looking for about a week. So that's the difference between the two. They both improve the texture and the pigmentation, but the Fraxel or Fraxel Dual or Fraxel Restore, these are all names for the Fraxel device, has more downtime and you get a little bit more beat up with one treatment versus Clear and Brilliant. There's no downtime and it's a pretty light, easy treatment, but you need about 4 of them to equal the results of a bigger Fraxel laser. So both of the lasers require about an hour worth of numbing. You can either come into the office and we place numbing on for an hour before the laser treatment, or sometimes we can even give it to you and have you run around. Where our practice is Fashion Island, people will go shopping and they'll come back. Or sometimes dermatology or plastic surgeon's office will give you the numbing cream to put on yourself, so you put it on about an hour before your treatment. And with that numbing cream on, even with the Fraxel, it's still a little, we say it's a little spicy. It could be a little painful during the procedure, but it's probably like 2 or 3 out of 10 on the pain scale. I mean, it's usually higher. But with the Clear and Brilliant, even with the numbing cream on, you don't feel anything at all. It's like painless. So after the Clear and Brilliant, sometimes you're red for like half an hour or hour later, but after then, again, there's no downtime and you can go out that night. I usually do it before events and nobody even knows. But you're usually just red more from the numbing cream, not the laser itself. Now what happens is with both laser devices is people always expect to peel afterwards. Fractionated lasers don't peel like a chemical peel does. So usually you have a chemical peel, Jesner's peel, glycolic acid peel, whatever type of peel, and 3 or 4 days later your skin kind of comes off in sheets. That doesn't happen with a laser. So sometimes patients will come in and say, Dr. Kappel, I came in and my skin wasn't peeling off, I didn't have a good result, or I didn't get the downtime that I was expecting. That's okay. Instead, with these fractionated lasers, instead of peeling, what you do is you have this almost like sandpaper feel to the skin because of all these little microscopic holes essentially that we poke into the skin, which sounds scarier than it is. You can't even see these microscopic holes, but basically it causes these little pinpoint scabs, and what happens is you can't see those scabs, but when you run your fingers or your hands over your face after the laser treatment, it'll feel kind of like rough or sandpapery, kind of like a cat's tongue. So it's like a sandpapery feeling that lasts for about a day or two, then that desquamates or just kind of debrides off, and then you have fresh, smooth skin underneath. So doing things like fractionated lasers, whether it be Clear and Brilliant or whether you do the bigger gun Fraxel, it will always benefit your skin. It's inducing your body's own regenerative processes to stimulate collagen, increase cell turnover, and could just kind of turn the skin cells on to behave and act in a younger and healthier manner. So little things along the way, you know, I recommend at least once a year doing one of these laser treatments. I try to do at least a Clear and Brilliant on my own skin, you know, at least 2 to 4 times a year. And I've been doing it since my early 20s. And it just basically enables your skin to kind of repair itself, renew itself in a really healthy manner. So I always look at my 4-year-old daughter Riley and I say, when she's older, there's going to be, facelifts are going to maybe even be a thing of the past, because to take someone into an OR and pull their skin is probably not going to be necessary with today's technology and the advances in technology that are down the pipeline. By doing little maintenance treatments and inducing your skin cells to be healthy from within and inducing your body's own regenerative processes, you're not going to just do nothing and just age helplessly and then all of a sudden have a surgery that's going to make you look different than you were before. You're going to just kind of take your time and just do things like laser and using good products and doing chemical peels and using good skincare products that are going to allow your skin to look its best at every age. If you look at celebrities like J-Lo, I mean, she doesn't look different than she did 30 years ago, but she looks the same. That's the goal, and that's the way of the future. You don't do nothing. You basically just do little maintenance, just like going to the gym 3 to 4, 5, 6 times a week, eating healthy, getting your sleep, drinking your water, and you basically just maintain your look for 30 to 40 years. You don't just have things go to crap and then basically try to rewind the clock by doing some big procedure that's going to make you look different. That's not the goal. You want to be like J-Lo. You want to look the same for a 30 to 40 year stretch. And so that's kind of the way of the future, and that's what all of these advances in technologies are allowing us to do. So Fraxel laser, I recommend it. It doesn't have to be the only thing that you do, or you don't even have to do it, you know, if you prefer something like a chemical peel or an energy-based device. But doing little things along the way definitely helps and will keep you looking your best at every age. So laser resurfacing, whenever we say resurfacing, it literally is resurfacing the upper layer of the skin. It's basically taking these zones of thermal treatment and treating that column, whether it's ablating that tissue out or just heating it up, dispersing that heat and just stimulating collagen in the surrounding skin and allowing that skin that was treated with the laser to be repopulated by new and fresh skin. And so along the way, just doing things like this will over time make us look our best. It can erase things like acne scars. Definitely several treatments are usually needed, especially with more severe acne scarring. We always say, you know, at least 3 to 5 treatments, usually spaced 1 month apart, is ideal. It can eliminate fine lines and wrinkles. It can help with under eye laxity. These lasers can do a lot. And so If someone doesn't have the downtime, again, a Clear and Brilliant or Clear and Brilliant Permea is probably the better way to go versus a Fraxel. Now, the difference between a Clear and Brilliant and Permea, they're both the superficial, more mild, watered down forms of Fraxel. The Permea is more geared towards the pigmented skin, where someone has melasma or freckles or brown spots. That would be more the Permea side, versus the Clear and Brilliant is more for wrinkled or textured skin or shrinking pore size. So it's kind of like the Fraxel Dual that I explained earlier in this video that has the two wavelengths. One's more pigment, one's more texture. The Clear and Brilliant versus Permea is Permea is more towards pigment and the Clear and Brilliant is more towards texture. So I hope this helps. Fraxel lasers have come a long way, and there's a lot of new and exciting lasers and devices coming down the pipeline. As a dermatologist, doing clinical trials and being in relationships with these industries, it's a really new and exciting time, and there's a lot coming down the pipeline that I wish I could tell you about, but they're undergoing FDA approval right now. But the way of the future is just to keep your skin healthy and looking its best at every age by inducing your skin cells to behave and act younger and more healthy, not just passively doing surgery to make it look better. So I hope this helps you guys. Is that okay?
Yeah, that's good.
Okay. I don't know how long that was. It was 11 minutes.